sharp rise in coronavirus cases. New lockdown measures are being imposed on the northeast of England. British Health Secretary Matt Hancock told the Parliament that from Friday, people in the region would be banned from socialising with others outside of their households or support bubbles. He said there would be table service only in restaurants and bars, and leisure venues would have to close between 10 p.m. and 5 a.m. In some parts of the northeast, the rate of infections had risen above the 0.1% of the population.
Mr. Speaker, we've seen concerning rates of infection in parts of the northeast. Sunderland, for example, now has an incidence rate of 103 positive cases per 100,000 population. And in South Tyneside, Gateshead and Newcastle, the figures are all above 70. As a result, local authorities wrote to me earlier this week asking for tighter restrictions, and we've taken swift action to put them in place. From tomorrow, in Northumberland, North Tyneside, South Tyneside, Newcastle upon Tyne, Gateshead, Sunderland and County Durham, residents should not socialise with other people outside their own households or support bubble. Hospitality for food and drink will be restricted to table service only, and late night restrictions of operating hours will be introduced, so leisure and entertainment venues must close between 10 p.m. and 5 a.m.
The government has already tightened restrictions across England, banning social gatherings of more than 6 people. Now, Britain's overall death toll from the virus stands at 41,773. This is the highest in Europe.
Mr. Speaker, I know, the whole House knows, that these decisions have a real impact on families, on businesses and on local communities. And I can tell everyone affected that we do not take these decisions lightly. We agree with the local councils that we must follow the data and act, and the data says that we must act now, so we can control the virus and keep people safe.
Meanwhile, amid a crisis in Britain's coronavirus testing system, long queues of people seeking a COVID-19 test were seen in the Southend-on-Sea in eastern England. People visibly showing COVID-19 symptoms were seen in the queue outside a walk-in testing site, with some saying that they had been trying to get tested for 4 days. The government promised on the 16th of September to do whatever it takes to boost laboratory capacity after people across the UK were left with no way to get a COVID-19 test. The UK recorded 3,991 new positive cases of COVID-19 on Wednesday, compared with 3,105 the day before. It also reported a further 20 new deaths from COVID-19. Ollie Barrett is joining us live from London for more on this. Good evening. Thanks for being with us. Health Minister Matt Hancock has said that the North East will be put under lockdown following a rise in cases. What is the latest that you have for us on this?
Well, you've just set out the restrictions that are being put in place. That's exactly what we heard from Matt Hancock in those clips. This is because, as we heard from Matt Hancock, the government and local authorities are very worried about the rise in case numbers in that part of the country. So the northeast of England joins various other pockets of the UK which are also under restrictions which are tighter than we are seeing across the rest of the nation. We have had that rising case rate nationwide in recent days. Couple that with the fact that there is a real pinch on demand for testing at the moment, and the government is acting. It's been forced to deny today that it wants to impose a second national COVID-19 lockdown as a result of the rising cases that we've seen in recent days. But what is emerging is a picture in which large parts of the UK actually are shut down, in the sense that they do have stricter lockdown measures, if we can call them that, than the other parts of the country which remain under the nationwide guidelines. The restrictions which are being brought in today for the northeast of England cover around 2 million people. We think that across the United Kingdom, as many as 10 million people are under stricter social distancing and social measures in terms of lockdown, stricter measures than the rest of the country. So while the government is saying it's not moving towards a nationwide lockdown, we are, as cases rise, moving towards a situation in which quite large parts of the country are under lockdown of one form or another.
Right, the rule of 6. Ollie, the government believes, as you've said, that the rise in coronavirus cases can be controlled then through these local measures. following these reports that they've negated of the second national lockdown. But there seems to be huge issues with regards to the testing, with some people saying less test and trace and more trace and test.
Yes, that was a comment from the Shadow Health Secretary, John Ashworth, of the Labour Party in the Commons earlier, replying to Matt Hancock. The government says that it is still testing more than the vast majority of other European countries in total, but also per capita. What is happening is that there's a real surge in demand as children go back to school, students go back to university, people are encouraged back to work, and as a result, we believe, of some of the easing in restrictions we've seen in the British economy in recent weeks. Add that to the fact that the government is allocating a large percentage of its testing capacity to the care home network to try and avoid the same number of deaths that we saw in the first wave of coronavirus here in the UK. And then add on top of that the fact that there is a difficulty with the laboratory capacity in the UK at the moment, in the sense that it cannot process the number of tests that are being sought by the British people with that surging demand I mentioned previously. So add all that together, and we are seeing thousands of people over the course of this week unable to get tested, even if they are displaying symptoms. The government also believes that too many people are trying to get tested when they are not symptomatic, and so it's calling on people to be responsible in that regard and only try and get a test if they actually have symptoms or have been specifically directed to get tested by a medical professional.
Ali, thanks as always for that report.